Imagine living in darkness, not for a day, not for a week, but for years. Unable to see the faces of your loved ones, unable to read, unable to watch a sunrise. Now imagine that one invention could change all of that. An invention created by a black woman doctor who refused to accept the limits society placed before her. She broke racial barriers. She shattered gender barriers. And she developed a revolutionary device that restored sight to people who had been blind for decades. Yet today, few people know her name. This is the remarkable story of Dr. Patricia Bath, a pioneer, an inventor, a humanitarian, and a hidden legacy that helped millions see the world again. Chapter 1: A Childhood of Possibility. Patricia Era Bath was born on November 4, 1942, in Harlem, New York. Her father, Rupert Bath, was an immigrant from Trinidad. He worked as a merchant seaman and later became the first black motorman for the New York City subway system. Her mother, Gladys, encouraged Patricia's curiosity and bought her a chemistry set when she was still a child. The message from her parents was simple: never settle for less than your best. Patricia took that lesson to heart. She excelled in science and mathematics and quickly demonstrated an extraordinary talent for research. While still in high school, she earned a National Science Foundation scholarship. Most teenagers were worrying about homework. Patricia Bath was conducting scientific research. By age 18, her work on cancer research had gained national attention and earned recognition from scientific organizations. The future looked limitless. But America was still struggling with segregation and discrimination. And Patricia Bath was about to challenge both. Chapter 2: Becoming a Doctor. In 1964, Patricia Bath graduated from Hunter College with a degree in chemistry and entered Howard University College of Medicine. After entering Howard University College of Medicine in 1964, Patricia Bath became a member of Alpha Kappa Alpha sorority. She remained a proud, lifelong member of the sisterhood. The timing was significant. The Civil Rights Act had just become law. The nation was changing, and Patricia Bath intended to help shape that future. At Howard, she became a leader among medical students and helped co-found the Student National Medical Association. She excelled academically, earning honors and recognition for her work in ophthalmology, the branch of medicine that focuses on the eyes. Then, tragedy struck. In 1968, Dr. Martin Luther King Jr. was assassinated. Like many Americans, Patricia Bath was deeply affected. She joined the Poor People's Campaign and organized medical students to provide healthcare services to demonstrators living in Resurrection City, a temporary protest community established in Washington, D.C. Even then, Bath believed medicine should serve everyone, especially those often overlooked. That belief would soon lead her to a groundbreaking discovery. Chapter 3: A Disturbing Discovery. After medical school, Bath returned to New York and began working at Harlem Hospital. There, she noticed something troubling. Far more patients in Harlem were suffering from blindness than patients she observed at clinics serving wealthier populations. Why? Bath began collecting data. The results were alarming. Her research showed that blindness and glaucoma occurred at significantly higher rates among African Americans. Many people simply lacked access to eye care. Others had never been screened for diseases that could have been treated early. To Patricia Bath, this wasn't just a medical issue. It was a social justice issue. She believed eyesight was a basic human right. And she wasn't content to simply diagnose the problem. She wanted to solve it. In 1976, she helped create a new field called Community Ophthalmology. The idea was revolutionary. Bring eye care directly into underserved communities. Prevent blindness before it starts. And make quality vision care available to everyone. It was a concept decades ahead of its time. Chapter 4: Breaking Barriers. Throughout her career, Patricia Bath encountered obstacles that had nothing to do with medicine. She was often the only woman in the room, frequently the only black person, and sometimes both. Yet, she continued breaking barriers. She became the first African-American ophthalmology resident at New York University. She later joined UCLA's prestigious Jules Stein Eye Institute, becoming the first woman ophthalmologist on its faculty. In 1983, she made history again. She became the first woman in the United States to lead an ophthalmology residency program. Each achievement was historic, but her greatest contribution was still ahead. A breakthrough that would transform eye surgery around the world. Chapter 5. The invention that changed everything. One of the leading causes of blindness worldwide is cataracts. A cataract clouds the eye's natural lens, gradually blocking vision. For centuries, cataracts stole sight from millions. Patricia Bath believed there had to be a better solution. In the 1980s, she traveled to France and Germany to study emerging laser technology. There, she began developing an innovative new approach to cataract surgery. The result was the Laserphaco Probe, a device that used laser energy to precisely dissolve cataracts and remove them with far greater accuracy than previous methods. The procedure was safer, more precise, and more effective. In 1988, Patricia Bath became the first African-American woman physician to receive a medical patent. It was a historic achievement. But what mattered most to her wasn't the patent. It was the people. Patients who had lived in darkness for years were seeing again. Some had been blind for decades. Now, they could once again look into the eyes of their families. The impact was life-changing, and it continues today. Chapter 6. A Global Mission. Patricia Bath never viewed her work as limited to hospitals in America. Her mission was global. Through the American Institute for the Prevention of Blindness, which she co-founded in 1976, she traveled around the world providing treatment, training physicians, and helping prevent blindness. She worked in Africa, Europe, North America, and beyond. One of her proudest moments came when she restored sight to a woman in North Africa who had been blind for more than 30 years. For Patricia Bath, medicine was never just about technology. It was about human dignity, giving people the opportunity to fully experience life. Legacy and conclusion. Dr. Patricia Bath passed away in 2019, but her legacy remains alive in operating rooms around the world. Every cataract surgery improved by laser technology. Every patient whose vision is restored. Every young scientist inspired to pursue medicine. All carry a piece of her legacy. She proved that innovation can save lives, that compassion can change communities, and that one determined woman can help millions see the world more clearly. Patricia Bath was more than a doctor, more than an inventor, more than a pioneer. She was a visionary in every sense of the word, and her story deserves to be remembered. Coming up next on the Hidden Black Legacy Project, Dr. Patricia Bath helped restore sight to people around the world. But while one black woman helped the world see more clearly, another helped the world communicate in a whole new way. Her inventions helped make internet calling, video conferencing, and digital voice communication possible. Coming next, Marian Rogers Croak, the woman who helped give the internet a voice. The Hidden Black Legacy Project. The stories left behind. Like, comment, subscribe, share. A new story every Wednesday.